it's Tuesday. I have some time before my shift starts, so I'm gonna try and see if I can get through all my UWorld questions by the time I have to leave. Yesterday was GI clinic and today's GI clinic. Yesterday it started at 9 a.m. though and finished at noon, and on Tuesdays we usually do 1 p.m. to 3 p.m. So it's very short, and it's really nice because on Tuesdays I get to sleep in a little bit and do some work before I have to head into work. I really love the pace of the GI clinic because in those 2 hours we see about 50 patients, so it goes really fast. As soon as you get done seeing a patient, the doctor sees them, you finish writing the note, you go ahead and grab the next person. So I like the pace. I feel like I'm learning a lot. I also feel like I'm really starting to get the hang of it, the flow, the presentation, like what most likely is going to be ordered, the next steps in management. So I like that it's all coming together. It's been a lot of fun.
Total amount of people that are donating is actually quite small. Thank you so much.
Is a public health emergency.
Post-workout shake. It's Thursday and I'm on my way to my primary care clinic. This commute usually takes about an hour. This is the longest commute that I've had to do so far, so I've been listening to a lot of sketchy clinical, specifically trying to get through all of GI right now because I'm in GI clinic 2 out of the 5 days, so trying to brush up on all of that knowledge. But today, because it's an urgent care clinic, I really don't know what's going to come in. Today's going to be a really busy day in general. I have a meeting at 3 p.m. and then another meeting at 7 p.m. and we're going to be seeing patients all throughout because it's 9 to 5. I bought all these heels when I was pre-law because I would wear them to like law presentations, to like my class presentations and stuff. I haven't had a chance to wear them as a pre-med or in the hospital, of course, because I'm running around, but now that I'm in clinic, I can bring them back. I'm on my way to go play some pickleball with some people that I met on Facebook. So there's a group for like pickleballers in the state or in the neighborhood, and I just put out a message saying that I was new to the area and that I was looking for courts to play, and a couple of people reached out to me about them and their friends and when they meet up and what courts they play at. So I'm gonna go meet one of these groups. If I get kidnapped, this might be the last thing that's left of me, but otherwise I hope that it's going to be really fun. The weather's perfect, it's Friday, I got out of clinic at 4 p.m. so this will be the perfect way to just like end my work week, so I'm really excited to play again. Hi, today's Monday. I ended up not having clinic today, but of course I only learned that when I got to clinic and they told us that we were supposed to not come in because the doctor's on vacation. But they forgot to tell us that, yeah. So for the next 2 Mondays, I don't have to come to clinic, which is really nice. Mondays is GI clinic, and I think GI is the subject that I feel the most prepared for right now, because out of the 3 clinics that I'm in, GI clinic is like the most specific one. The other 2 see patients that more so like an urgent care, so with other primary concerns, but GI is like just GI. And on top of that, I finished all of the sketchy clinical for GI. So yeah, I'm only gonna have 2 more days of GI clinic left, which is my Tuesdays, and I feel like I'm ready to move on. And I mean that in the best way possible. I got this from Too Good To Go from a bakery. This was a freshly baked loaf of Italian bread, and I paid like $5 to get this and 3 other delicious pastries. Honestly, such a steal. And I don't even eat that much bread, so this is gonna last me forever, so I'm gonna give it a try. Also, I've had this urge to read a book, and I think mostly it's because I always see Aya reading books, and it just makes me want to pick up a book and read. So I don't know if this is her book or somebody else's book in the house, but I think I'm gonna read this. I've heard about this before, and I've wanted to read it, so hopefully I can get through it. This is like the best time to do it because I decided on a whim to unsuspend 2,500 old farm cards because I've been forgetting basic farm, and I've only gotten through like 500 of them. So I still have a 2,000 built up deck of farm cards to go through, and I decided this would be a great time to start a new book. Today was a long day. I was in my sports medicine / primary care clinic from 9 to 6, and we barely got a lunch today because patients were back to back. Patients were scheduled for pretty much like every slot of the day, and patients came in with a pretty extensive history, so there was a lot to talk about. So the appointments were as long as they could possibly be. But I got to diagnose a murmur today, which it was a systolic murmur, so I assume it was aortic stenosis based on history and just the way it sounded. Also, big shout out to Anki. It honestly, like the first time I've heard these murmurs, the gallops were all on Anki, and I would play those cards over and over, so I got so used to hearing it. And in real patients, it sounds the same. Like, you know when you hear videos on YouTube and you're like, and then you hear it in a person and you're like, this literally sounds nothing alike, how could I ever tell? Anki, compared to the real pathology that I see in patients now, is like so spot on. Anki is the reason that I'm so confident in saying, like specifying what murmur I think it is. And then I heard a gallop today, which is an extra beat. It was an S3, so I heard it after the S1 and S2, the normal lub-dub, and then the extra beat. And that was also really cool because that patient had a very extensive cardiac history and very recent cardiac surgery, transcutaneous mitral valve repair, and dilated ventricles. So very interesting. I love my cardio patients. And then I also diagnosed thyromegaly for the first time. I've never seen or palpated an enlarged thyroid, so I wasn't confident that that was exactly it, but I could tell just from looking at it that something was abnormal. And then usually when I'm uncertain of things like this and I'm the only one in the room, I'm not going to scare the patient and diagnose them with that when I'm only a med student. So I made the note in my head, and then I went and told my attending, and she checked, and we made sure that this patient now gets all the necessary thyroid function test labs and an ultrasound because she agreed that her thyroid was enlarged. So I feel like I'm getting the most out of these rotations that I can. I feel like I'm learning so much. I'm seeing so many different pathologies. I'm applying my knowledge, like everything is perfect. So the day was long, but the day was good. And now I'm going to go and cram in my 20 questions on UWorld and before I head to the gym. And I did my Anki interspersed during the day whenever I could, like in between patients after I wrote my note, and I had like a couple minutes before the next patient was, you know, vitaled and put into the room and all that stuff. And all of that is to say, like, even when the day is long, there's still time to, you know, do the Anki, to review previous content, to do all the new UWorld questions, to go move your body and go to the gym. There is time to take care of yourself and also to continue studying and doing all that. And I am tired, but I'm trying to push through today so that I don't have to do 500 Anki cards tomorrow and 40 UWorld questions tomorrow. But also I didn't have time to do anything else today, so it's kind of like a balance. I saw a patient with polio today who was vaccinated when he was a baby and then developed a reaction to it and basically had loss of deep tendon reflexes, loss of mobility, and muscular atrophy in one leg to the point where it was so skinny that it was pretty much just bone. And the minute he showed me his leg and said that he had polio when he was little, I could just picture the sketchy image of the flamingo standing on one leg in like the middle of the park. So all of that just came back to me with the DTRs, muscular atrophy, ascending paralysis, all of that. So it's crazy how ingrained in your head those images get and how much it's still helping me in a clinical setting. But yeah, that was very interesting. It's also very interesting because he came in for a completely different reason, and this is gonna happen a lot, and it is, where you go into a patient room and their chief complaint is one thing, but once you get them talking, you actually realize that they're there for multiple things, and one thing might be, you know, bigger than the chief complaint that they're actually in for, because he just had some ringing in his ears, and then he had this. So that was a very interesting patient to end my Friday with. It gave me a lot of information to look into and research on UpToDate, and just become familiar with like the polio vaccine adverse reactions and all the things, because I feel like there's a lot that I have to brush up on. Also, I know UpToDate is known for being notoriously confusing and like so many details, and just like basically everything you could possibly think of a disease or anything it's going to be on there, so it's hard to like sift through and find exactly what you're looking for. And we got trained at our school to start looking into UpToDate first and second year, especially second year. They would make us go into UpToDate and research specific things to get us comfortable with it, and at the time it was so annoying because I just felt like it was so much easier to like Google and find something or use a different resource, and UpToDate was too much. But all of my attendings that I work with here use UpToDate, and I've gotten into the habit of looking into it myself, so I pretty much use it every day on the job if there's something that I'm not sure about, and it's become a lot easier. I know people have told me to try other resources, but all my attendings use UpToDate, so I trust that it's a good resource. My school taught me to use UpToDate, and it has gotten a lot easier now that I've been using it every single day, so I think it's just the learning curve that you get past, and then after that, it's totally fine.